Hi, you guys. My name is Dr. Cade, and I'm here with Dr. Duane once again. And today we are going to talk about why do kids need to be adjusted? Is that really even a thing?
Yeah, I think so. I have 2 kids, and they're doing pretty well with adjustments.
You adjust them? Okay, well, that's a good sign. You got to practice what you preach, folks.
Yep.
You got to practice what you preach. So we're going to talk a little bit about this. We are a family office. We take care of a lot of pregnant mommies. We've got a lot of newborns. Actually, our first patient this afternoon is a brand new baby, which we are so excited to meet. What a blessing. But why is that parent really bringing that baby in? What we want to do is lay out 3 different things real quick on why it's so important to get adjusted and take care of your spine and your neurology immediately. So starting off, my wife, our first child, Curran, it was 45 hours of natural labor. I'll never forget that story, but it was the most stressful situation that mentally and physically that I've ever seen my wife go through. And undoubtedly it was the same thing for my son, Curran, and for all of us. That birthing process is incredibly stressful. Now we think about mom so much in that situation, which we should, right? But we also need to think about that baby. So when that baby is sitting in the womb for 9 months, the rotation of mom's hips are going to play a huge role in what that cradle looks like, that baby sitting in the womb. The position of mom's spine, too much curve, too little curve from the side. Same thing, straight or curve from the front is going to play with the position that baby's going to be in. So that's the 9 months of holding baby. But when it does come time for birth, again, the birth canal is directly related to the position of mom's hips. And however hard or however easy that is, a lot of times really has to do with the position of mom. And there's a mental factor that goes into that too, but that's a big, big part. So we love taking care of moms, but when that baby comes through, baby is going to really be affected by what was going on here with mom. So, how do we know if this stuff is happening to baby? Well, does baby favor nursing on one side versus the other, right? Does baby favor holding their head on one side versus the other? Now, there's things like torticollis, which is a severe spasm of the SCM muscle here where baby literally can't unlock that, which is not super common, right? But are there other things that baby's doing? How about when we're holding baby? Mm-hmm. How about when we're cradling baby? How about when we're changing baby's diapers? Those small patterns that started here in the womb, they neurologically imprint and they turn into you and me when we're in high school, when we're an adult. And those small little shifts, those small little changes, maybe fractions of a millimeter, they turn bigger and bigger. They compound as we get further on down the road of life, right? And so a lot of times now when we see, athletes in high school, or even we see adults, right? Yep. Those patterns are hard for us to break because they started all the way back here. So we love seeing kids, we go through a gentle process. Their bones really aren't quite bones yet. So we see just magical results with children. It's unbelievable. But we have to see them. We have to check them. And if there's nothing for us to do, there's nothing for us to do. But we've got to check it out and make sure that we can prevent something from turning bigger down the road. Now, my wife gave a natural delivery with our first and with the rest of our 4, thank God. But it was a little different situation for your first, wasn't it?
Yeah, and we didn't find out with our first daughter. She's 6 years old right now, but we found out she was breached at 39 weeks, and we were under the understanding that she was in the right position, and we had kind of taken and felt her and said, hey, okay, that must be what it feels like. But here, actually, our daughter's head was up in my wife's right liver area right there. And when the C-section happened, we tried everything before that. We tried natural, we tried our maneuvers chiropractically, and we even tried more aggressive ones, which my wife said she'll never do again. It was painful. But everything didn't work, so we just said God has a plan for us, so we had to do the C-section. But my daughter's head was literally suctioned up in there. We had no idea, and we were doing treatment too before that, and it was just the plan that we had.
Sometimes things like that are over our pay grade, but we always have to have a plan. Whether things go our way, we want to have a plan, and if they don't, we want to have a plan. So after having that C-section, what are some of the things that started to show up down the road with Haley, and what are things that people can take an eye out for? How do you identify those things?
Well, I think that's our second biggest point right there, are what are called primitive reflexes. And we have those primitive reflexes there for a reason. They're to help the baby get out of the mother's womb and to breathe and to reflex, especially when they're laying on the ground, to roll over so they don't roll over on their face so they can't get oxygen. So those reflexes need to be checked. And so looking at my child, since she didn't naturally come out of the birthing canal, she had some developmental, some behavioral issues when she was getting into her 3-year-old years, where she couldn't inhibit, she couldn't stop. She would just go. She would just blow through, any kind of thing that me or my wife would tell her, like, hey, honey, don't run out in the street. and then she became 3 and then 4 years old. That's when we started saying, hey, we need to check those. And obviously I had checked those before that, but that's something that's very important to check, because if those things aren't integrated properly, if she didn't go through those and integrate them by actually doing a natural process, then they become behavioral issues in the future, or they become things like food sensitivities. Yep. Or food aversions more.
Yep.
Food aversions, or maybe light and sound sensitivity. A big one is the moral reflex, the startle reflex, where you see people that are still jumpy in their teens and in their older years. When you go and check them, they might still have something that hasn't been integrated in the moral, the startle reflex.
So I love the way that he explains this, and I think we could do just a talk alone on these things and how important they are and how you are picking up on these things on our adult patients. It's unbelievable. But as the brain matures, we have these milestones, like you said. We have a reflex in our body that if we're suffocating, our body is going to try to get away from that.
Yeah.
Once our body figures out how to use its hands and deliver us away from that danger and get us into safety, our brain goes, okay, I can figure this out. We're closing the door on that. We're sealing it up.
Yep.
But for some of us, we don't ever really fully close that door. Our brain maturity doesn't get past that point. So if we're still kind of stuck in that immature phase, that starts showing up, just like you said, in other areas. Difficulty going to sleep, identifying, is this danger or is this something that I can go through, right?
Yep.
And it's interesting how that shows up in these things. And again, we get so frustrated, again, if our kids aren't sleeping, if they're not listening to us, if they're having a hard time learning, we get frustrated at those symptoms. And we need to go back to the root cause of what's really happening up here first, instead of trying to treat those symptoms, covering it up, even with a natural thing versus a medication. We still got to get down to that root cause. And I love how you tested those primitive reflexes on all the patients, not just kids, to see if we're getting past those developmental milestones. It's unbelievable. So I think we've talked a little bit about structure. We've talked a little bit about the neurology that controls so much more than what we think. When is the most important time to get adjusted?
I think as soon as possible.
Let's rephrase that and make it even sharper. When's the most important time to get checked?
Well, when it is right after the birthing process, I would say.
Now, I used to be the nutrition director for the birthing center here in town, and we've been to a couple different live births. We've been up there and adjusted, so many patients, within a couple hours after birth, both mom and the baby. But what we really want to say is it's so important to get checked and figure out if this stuff is happening in your child. And then there's a natural solution that we get to step in and we get to right that and prevent it from turning into something bigger down the road. It's gentle, it's safe, it's effective, it's incredible. The statistics show that you are happier, you are healthier, your immune system, your neurology, your ability to grow as a human being is better. It's simple. And so we love doing that here at LIFEstrength Health Center. And our number is 239-774-5433. If you have questions on any of this stuff, if it's a right fit for you, how we do this, we are happy to help and to serve you. That's what our heart is. And so there's a free 15-minute consult available anytime. We'll make it work for your schedule. And if it's not the right fit, we promise to tell you that too. So I'm Dr. Cade. This is Dr. Duane. Thank you so much. We're hopeful that you learned a couple things from this, and we're hopeful that we get a chance to meet you as well. Thank you again.